Now, we've just put on the sterile gloves. We're getting ready to put the bandaging onto the patient. So we've already checked to make sure that the skin is okay afterward. We've checked that there's no major redness or anything like that that may have been a problem for the patient in the Whirlpool. Okay, so what's next?
Drying it.
Okay, so we're going to dry it. So you're going to use your clean hand to undo the packaging there. Beautiful. Make sure you're not over the top of your other stuff over here. Okay, and then you can pick up the sterile towel from one side, gather it with your clean hand, good. Okay, and then she's just going to dab around the wound itself. So not totally, not touching the wound, just going around the outside of that sterile area. Okay, and then she'll hold that part up so she doesn't use it by accident and dry off the rest with the clean part of the towel. Okay, and she gets between the toes, behind, underneath the foot, everything at that point. Okay, we're going to fast forward a little bit. That would go, again, make sure you don't contaminate anything here. That would go into your linen bag. Okay, don't put your hand right in there. You want to make sure this stays sterile. Okay. What would be next?
The gauze.
The gauze. And when you're doing this, you want to grab the gauze in your sterile hand and the roll in your other hand, because the gauze won't stay on while you're going to get the roll. So put the gauze on, and immediately, now once it's covered, everything becomes clean instead of sterile. Okay, so now she would put that on. Yep.
So now can she turn your back towards the field?
Towards the field being wound.
No, towards the table.
Towards the table.
Towards your back.
I have this table moved back a little bit. She originally had it over here where she could have seen it. I moved it back for the camera, but you're right. I mean, this would have been up where she could have kept it within her vision. So
So it needs to be in your vision.
Yep.
I'll lift your foot up.
Yep.
And you can't turn your back to the wound either, right?
Right, so have everything kind of in front of you a little bit there. Okay, so you'd wrap that around. At that point, you could help the patient. Just go ahead and unwrap it now. So
Okay.
again, we're going to fast forward a little bit.
Mm-hmm.
Okay, at that time, you'd help the patient put their sock back on if the sock fits over. They may have like a cast boot or something that they're wearing if they have a big bandage. Otherwise, they may have to like undo the laces of their shoe or something to make it big enough. Okay, I'll take that. Don't worry about that right now. You would then, what's next on the?
Bye-bye, patient.
Okay, so you're going to help your patient. Again, you haven't touched the wound or anything, so your gloves can both be considered clean at this point.
And her shoes
Okay,
are
you would have already
on.
put her sock and shoe back on.
Okay.
Dispose of everything in the area.
Yeah, so go ahead and help your patient down. Use the gait belt and help her down, stabilize the
You
chair.
wanna use my shoulder there?
Stabilize the chair with this hand.
I
Oh,
see.
yeah, with that hand, I'm sorry.
Okay.
Okay, and the patient's out of there. Now what does she do?
Take,
Besides take the gait belt out.
dispose of
Have a
the
great
stuff.
day.
Thank
I
you.
hope that feels better.
Okay, and we said you weren't non-weight bearing, so you can just walk away.
Right. Okay.
Walk away, patient.
Now,
Dispose of the stuff. Leave
Okay,
one glove on.
disposing of the stuff, remember now everything's considered contaminated. So if you have something like this, you wanna fold it all in on itself. Make sure that you don't just pick it up where everything could fall off from it. Okay, then fold it all in on itself. Good. Okay, what's gonna come after that?
Leave one glove on.
Okay, so
And the
take
other-
one glove off, leave the other one
doesn't
on.
matter what one, because
It's whatever hand you wanna use to clean the Whirlpool, you leave the glove
yeah,
on.
we're gonna get rid of that glove. That is not on right now. But I wouldn't have flicked it like that. It wasn't
Okay,
right.
so the other one she can use to clean the Whirlpool, and she'd use Common on the inside, Fantastic on the outside, the antibacterial soap in a bucket to clean the turbine. Okay, so which we did in the other lab. Okay, anything else on there? There should be more.
Then throw the other glove away.
Okay, so once she's done, be careful how you do this. Once she's done cleaning the Whirlpool, she'll use sterile technique to kind of make sure she doesn't contaminate herself with that glove that may have Common on it
Shoot
now, right?
stuff everywhere.
Jeez, been used in a while again.
Okay, carefully take the
Think you got
gown
it.
off. You don't have the mask to breathe into this time.
Right.
Yeah,
Yes.
that's nice. careful,
Oh.
you don't let that sleeve touch your bare hand.
Double bag.
So double bag that, the linen one, and mark it as linen, double bag the trash, mark it as trash.
Go wash
Wash
your
your hands,
hands.
done?
Yep.